All right.
Hello, and thanks for joining us to learn more about the CSD's 2023 advocacy priorities. I am Kelly Barta. I am the Executive Director of the Coalition of Skin Diseases. And in this segment of our training, we're going to be focusing on ensuring that advocates have all the tools and answers they need to successfully meet with their members of Congress. With us today is the CSD's Washington representative, Philip Goglas II, to discuss our coalition's legislative priorities. So thanks for being with us, Philip.
Thank you, Kelly. It's great to be here.
So can you tell us what are the main areas of the CSD's legislative priorities this year?
Sure. So our priorities revolve around three main areas. One is medical research. It's critically important for there to be continued robust support for medical research to help us better understand skin diseases, the onsets, the causes, and the research leads to possible treatments. So it's very important that we continue to support robust medical research. The second part is patient access to treatments. It's great that we have research that can lead to new discoveries and can lead to development of treatments, but it's important that once those treatments are available, that our patients are able to access them, and there aren't these numerous hurdles to being able to access these treatments that we know would be effective to treat their skin diseases. And last is education and awareness. Of course, as we've talked about and how to be an advocate and why advocacy is important, being able to raise awareness and educate decision makers is critically important. So we like to focus on these three areas, ensuring that there's robust medical research, access to treatments, as well as ensuring that we are educating and raising awareness among decision makers and the general public about the skin diseases community and our priorities.
Great, thank you. So can you tell us a little bit more about the key medical research priorities?
Sure. So we are very supportive of robust funding for NIH, which is National Institutes of Health. As we mentioned in a previous video, they are the premier research agency that we have in our country, and they support a lot of good research that is done that help us better understand skin diseases and help us to work towards those treatments. The National Institutes of Health has been robustly funded over the past few years, and we ask for that to continue. So we are asking for at least $50 billion for NIH funding in fiscal year 2024 to ensure that there continues to be that support and opportunity for research. We specifically work with the National Institute of Arthritis and Musculoskeletal and Skin Diseases, NIAMS. You see why we live in a world of acronyms. But we work specifically with NIAMS because they are the main institute that oversees skin disease research. There are other NIH institutes as well that support research for our community, but NIAMS is primarily where a lot of research is housed. So we want to make sure that both the NIH overall, because again, as I mentioned, it's not just NIAMS that we work with for research, but the NIH overall, as well as different institutes, have robust funding to allow them to fund research across the board.
Thanks so much for that. So can you tell us what are the key patient access to treatment discussion points?
Sure. We are in a brand new Congress, so there are, a lot of pieces of legislation that were introduced in the last Congress that we were supportive of that have yet to be fully introduced in this Congress. But we focus on a few areas. Access is critically important, again, for our community. So we are very active on step therapy legislation. We were very active with the Safe Step Act in the last Congress. The Safe Step Act has yet to be reintroduced in this Congress as of this recording. Of course, it may be introduced closer to our Hill Day, but we support the goals behind that step therapy legislation, the Safe Step Act, to ensure that we are not forcing folks to try fail-first therapies in order to be able to receive the quality treatments that they need. We also are very much against copay accumulators, as that truly does prevent critical access to necessary treatments, especially because they will lead to higher out-of-pocket costs. Right now, there is a bill that has been introduced. That's the Help Copays Act, which is HR 830, and it's been introduced by Congressman Buddy Carter and Congresswoman Barragan, amongst others. What's important about this bill is that it requires health insurance plans to apply payments made by or on behalf of an individual towards those cost sharing requirements. We want to make sure that these out-of-pocket costs aren't being increased, or you don't have a situation where a patient's deductible and out-of-pocket maximum aren't being accounted for any assistance that they have. So we want to make sure that because there is help, that you don't lose sort of your coverage or your ability to afford your medication. Legislation closes a loophole that deems certain covered drugs non-essential, and we want to make sure that we fix all of that. So this bill is incredibly important to our community to ensure that these private plans count all cost sharing for covered services to accrue to a patient's deductible and out-of-pocket maximum. So that bill is something that we've been supportive of in the past, and we continue to be supportive of. Another bill that we were supportive of in the last Congress was the PBM, the Pharmacy Benefit Managers Bill. It has yet to be reintroduced in this Congress, but what we want to support in that space is legislation that bans deceptive, unfair pricing schemes, which also at the same time prohibits arbitrary clawback, of payments made to pharmacies, and then requires PBMs to report how much money they make through spread pricing and pharmacy fees. Again, another practice that we have seen that unfortunately severely limits patients' access to the therapies that they need. It's great when we have robust medical research that allows there to be these developments for treatments and to have, treatments available, but all of that is almost for naught if there's not access to that, and our patients aren't able to access and utilize those sometimes life-managing medications.
Great, thank you. So can you tell us a little bit more about the legislative asks around education and awareness?
Sure. All of the great work that NIH does is fantastic, but what's important is that those findings be disseminated. And the NIH is solely a research hub. They're not a public health agency such as the Centers for Disease Control and Prevention. So at the CDC, there is a program that focuses on chronic disease education and awareness. This program allows there to be grants for conditions that are not already receiving specific money at the CDC for education and awareness activities. Some of the coalition members have been fortunate over the past few years to receive funding from this program and have begun to work on critical education and awareness activities to better raise awareness in the general public, but also provide education to the medical community about new breakthroughs or anything that is sort of state of the art that will advance treatment of skin diseases. When we talked about our, why advocacy matters, education and awareness is critical, and we support the program at CDC at this year's funding recommendation of $6 million. Again, the more money that program has, the more grants they're able to fund and support to raise education and awareness around the country.
Yeah, that's great. So can these priorities change throughout the years? All of the things that we have talked about up to now, can you give us a little bit more insight on that?
Sure. So we treat our legislative agenda as a living document. There are things that, I mentioned were introduced in the previous Congress that we were supportive of that may or may not be introduced in this Congress. We just have to wait and see. There also may be new pieces of legislation that weren't ever considered before that a member of Congress decides to introduce. What we do is we look at every piece of legislation that's relevant, that is being introduced, and look to see what effect it has on our patient community. Is it something that is beneficial? Is it something that's detrimental? Or is it something that we're sort of neutral on? Those bills that we're sort of neutral on, we see that they're introduced, but we don't really take action on them. Any bill that we see that would greatly benefit our community, such as help copays or a possible reintroduction of the Safe Step Act, we activate on that to ensure passage, and we list that as one of our priorities, and we work to raise awareness on that. If there's an issue that a bill is introduced that would be detrimental to our community, we would look at that and say the goal of this bill does not benefit us and may present a risk, or there's something we don't like in that policy that would have a detrimental effect for our community. What we would then do is activate on that to raise awareness against that proposal on behalf of our community. So we sort of roll with what Congress does. Our appropriations requests are there for this year. As we go into the next calendar year, those will change again because appropriations are done on an annual basis. But some of these other legislative priorities, you might see additions to as Congress continues to work through the first session and into the next session.
Great, thank you. I just wanted to let everyone know also for our Hill Day that's coming up on April 23 through 25, the priorities that we'll be talking with Congress about will be gone over in a prep webinar a week before we head to Congress. And then we'll also be having some training while we're there on the Hill to really go into detail on this legislation that we're supporting. So Philip had mentioned the Safe Step Act and the Help Copays Act. We'll really make it easy to demystify that whole thing, because sometimes it can be hard to kind of grasp, how does this affect me? How does my story fit into context here? But we will help you with that process as we get closer, but this is just a general overview for everyone. So thank you, Philip, so much for explaining all of this to us and for taking your time to be with us today. If any of you wants to see more of our videos on advocacy, you can find them on our YouTube channel and on our CSD website. Thanks so much.
Thanks, everybody.